So today on
Unmasking Parasitology. So today we're going to talk about one particular kind of parasite, which is
cestodes.
Cestodes, actually just 5 of them, 5 kinds of cestodes, which is?
First is Hemilelepsis nana, and the second is Diphyllobothrium latum.
See, we have it all tangled up. Echinococcus granulosus, Taenia saginata, and Taenia solium. So that's a whole bunch of them, but mostly we're going to talk about its disease etiology,
disease transmission and life cycle,
disease manifestation,
laboratory diagnosis,
treatment and prevention,
and the latest public health report.
And by latest public health report, we mean latest cases that we know of today.
So let's now discuss the culprits of these marvelous diseases.
It's not actually marvelous.
Disgusting? Disgusting. There are 5 of them. The first is, yes, Hemilelepsis nana. Diphyllobothrium latum, Echinococcus granulosus, Taenia saginata, and lastly, Taenia solium.
It's somewhere up there.
Yeah.
Go. So now, finally, we're going to move on to our latest health report. So by latest health reports, we mean the latest cases that we know of the 5 different kinds of cestodes that we've talked about so far today. So to start off, we have.
So first case will be hemelepiasis in a pregnant woman. This was published on January 1, 2019. Wow, Happy New Year to that pregnant woman. So, case presentation. A 24-year-old female patient in her 35th week of gestation presented to the medical outpatient department with complaints of loose stools not associated with blood, with a frequency of 10 times a day for the past 2 days.
Wow, that must be bad.
Yeah. The patient gave a history of 2 episodes of vomiting and pain in the abdomen. There was no history of fever, rash, burning micturition, white discharge, and vaginal bleeding. The first and second trimesters were uneventful. The patient gave a history of appendectomy 5 years back, and general physical examination was normal. So, complete blood picture revealed a mild anemia, and there was no eosinophilia. Ultrasound revealed single live intrauterine fetus, which is her baby, in cephalic presentation with a mean gestational age of 35 to 36 weeks and mild polyhydramnios. What's that? Stool examination for intestinal parasites and for the presence of occult blood was advised. Direct stool examination using a simple wet mount with saline and iodine mount revealed eggs or ova that morphologically resembled Hemilelepsis nana. Oh, wild. So, wow, the adult worm revealing the rostellum, which is the black arrow, scolex, red arrow, and oh no, got it. So the second case will be.
So for the second case, we have 2 cases of Diphyllobothrium latum infection in immunocompetent hosts. So this report was actually published on May 2, 2016 by Dr. Joseph J. Hugh. So, most cases of acute diarrheal illness can be attributed to infectious causes, including viruses, bacteria, and protozoa. While viruses are thought to cause the majority of acute infectious diarrhea, estimates regarding the frequency of pathogens vary greatly depending on the population being studied. So, a case of a 34-year-old Caucasian man with no significant past medical history presented in outpatient clinic with 7 days of diarrhea and 1 day of vomiting, abdominal cramping, and chills. The patient described his diarrhea as liquid brown, associated with nocturnal bowel movements and exacerbated by food, resulting in poor appetite. His diarrhea was alleviated only by decreasing oral intake. He denied any blood in his stool but did present with an approximately 3-foot flatworm which he passed in his stool the evening before presentation. How long? Oh my gosh, that's so long. Okay, so the patient denied sick contacts or any recent travel outside the United States, but had visited New Zealand approximately 5 months prior. The patient also reported eating uncooked sushi.
Oh, I love sushi.
Uncooked sushi approximately twice a week with a recent fishing trip on the day his diarrhea started. Review of systems was negative for fevers, night sweats, or involuntary weight loss. Physical exam was notable for an increase of an obese abdomen, but was otherwise unremarkable. Abdomen was soft and non-tender to palpation and had normal bowel sounds on auscultation.
Okay, so for the next case, like Timmy said, it's Echinococcus species tapeworms in North America. So alveolar and cystic echinococcosis are emerging and re-emerging in Europe, Africa, and Asia. The expansion of Echinococcus species tapeworms in wildlife host reservoirs appear to be driving this emergence in some areas. Recent studies suggest a similar phenomenon may be occurring in North America. We describe the context of Echinococcus species research in North America with a specific focus on the contiguous United States. Although studies were conducted in the United States throughout the 1900s on various sylvatic and domestic Echinococcus species tapeworm cycles, data are lacking for the past approximately 30 years. So, yeah. We review previous research and provide analysis of more recent focal studies and suggest that Echinococcus species tapeworms, in particular the E. canadensis, may be under-recognized. As a result, we suggest that additional research and surveillance can be conducted for these tapeworms in wildlife host reservoirs across the United States. So for the next report,
Okay, so for Taenia saginata, we have a case of a co-infection case report of Taenia saginata in a patient with subclinical clonarchiasis confirmed by the combination of diagnostic tools. So this case was published on February 6, 2019, but was actually received on September 2, 2018. So about it is clonarchiasis is the common parasitic infection in the general population of the Republic of Korea. However, Taeniasis, it's me, Taeniasis. Taeniasis. Okay, so Taeniasis is scarcely reported recently. Here we describe a case of co-infection with the cestode T. saginata in a patient with subclinical clonarchiasis diagnosed by a combination of diagnostic tools in Korea. So a 56-year-old man visited the hospital having passed proglatids in his stool for the past 2 months and brought a stool sample with segments to their hospital. So he had the abdominal symptoms such as nausea, vomiting, abdominal pain, diarrhea, or constipation. He used to consume raw beef and fish frequently. We could not find evidence though of gravid proglatids which contain fully developed uteri filled with ova or branched uterine structures within the submitted sample. So their conclusion is that their case indicates that a combination of morphological, serological, and molecular diagnostic tools should be used for the accurate diagnostic of subclinical parasitic infections. So for the next case, it's not her who's going to report, it's me! Oh, you're stuck with me. Anyway, so for Taenia solium, we have the case of Taenia solium cysticercosis in West Africa. So this was published online on September 18, 2018 by multiple authors. So we have Melky, Coffee, Boca, Ture, Sumahoro, and Jambu. So those are all last names, obviously, I guess. Anyway, so as for the case, we have cysticercosis is caused by the larvae of the cestode Taenia solium. Few data are available on the prevalence of this disease in pigs and humans in West African countries. The aim of this study was to provide an overview of existing data concerning the spread of this parasitosis in the country of the Economic Community of West African States on the basis of the literature published over the last 5 decades. Systematic searches for publications were carried out on PubMed and Google Scholar, as well as in certain regional and local journals. From a total of 501 articles initially retrieved concerning T. solium cysticercosis in West African countries, only 120 articles were relevant for this review and therefore finally retained. For pigs, only 8 out of 16 countries of the region have reported porcine cysticercosis. Post-mortem examination of carcasses at slaughterhouses, meat inspection at butcheries, or tongue inspection in herds have been the main source of data, but may not entirely affect actual data on neurocysticercosis of parasite distribution. For humans, only 5 out of 16 countries reported epidemiological data on neurocysticercosis. Most data referred to neurocysticercosis, prevalence among epileptic patients or isolated clinical cases. Furthermore, Existing data are often old, and it's not really quite common today.
So that's all for the public health department.
Hymenolithiasis is Hymenolithus nana infection. The cycle starts through ingestion of the worm's eggs from human stool. It doesn't require intermediate hosts, but various species of beetles and fleas may serve as one, and it will develop into a larvae, which can infect humans and rodents upon ingestion, and will develop into adults in the small intestine. When the eggs are ingested in contaminated food or water, or from hands contaminated with feces, the larvae contained in the eggs are released and penetrates the villi of the small intestine. When the villi ruptures, the larvae returns to the lumen of the small intestine and fold back its head part and attach to the intestinal mucosa. It develops into adults that reside in the ileal portion of the small intestine. The eggs are passed in the stool when released by an adult worm or when it disintegrates in the small intestine. Reinfection occurs when eggs remain in the intestine and releases an egg which penetrates the intestinal villi, thus continuing the cycle.
Diphyllobothriasis, Diphyllobothrium latum infection. The life cycle starts when immature eggs are passed in the feces of an infected human. The eggs mature in water from larvae called Coracidia, which hatch and get eaten by freshwater crustaceans and develop into procercoid larvae in the body cavity of crustaceans. If the infected crustacean gets ingested by a small freshwater fish, the procercoid larvae are released from the crustacean and migrate into the fish flesh, where they develop into a plerocercoid larvae, which is the infective stage for humans. These infected small fish can be eaten by predator fish. If a human eats the infected fish raw or undercooked, the plerocercoid larvae develop into adults in the small intestine. As these larvae mature, they release immature eggs, which are then passed in the feces.
Echinococcosis is the infection of Echinococcus granulosus. The cycle starts when an adult worm inhabiting the small intestine of the definitive host releases eggs in the stool. These eggs are then ingested via fecal-oral transmission by the intermediate hosts, allowing for the eggs to hatch and larvae to penetrate the intestinal wall and be taken up into the bloodstream into various organs, especially the liver and lungs. In these organs, the larvae develops into a cyst or a hyatid cyst that enlarges gradually and produces new daughter cysts or brood capsules. Inside each one of these capsules is the head of a tapeworm folded in on itself. The definitive host becomes infected by the ingesting cyst-containing organs of the infected intermediate host. After ingestion, it hatches, folds back on itself, attaches to the small intestine of the definitive host, and matures into an adult worm, thus completing the life cycle. Humans become infected by ingesting eggs in food or water and even accidentally in soil contaminated by the fecal material of an infected dog.
Taniasis. Humans are the only definitive hosts for this, and it starts when eggs are passed with feces. Cattle, or T. saginata, and pigs, T. solium, become infected by ingesting vegetation contaminated with eggs. In the animal's intestine, the eggs hatch, producing larvae that penetrates the intestinal wall and migrate to the muscles, where they develop into young worms. Humans become infected by ingesting raw or undercooked infected meat. In the human intestine, the young tapeworms develops into an adult tapeworm. The adults produce eggs which mature and are passed in the stool.
The cestodes, commonly called tapeworms, are parasites of the taxonomic phylum Platyhelminths, class Cestoda. The adult forms have flat and ribbon-like bodies that are usually white to yellowish in color. They completely lack digestive systems and acquire nutrients mainly by absorption through their outer covering called cuticle. Each cestode body consists of 1. An anterior attachment organ called scolex. 2. A neck region immediately posterior to the scolex. 3. A strobila, which is a chain of segments. The scolex possesses suckers and hooks that attach the worm to the host tissues. The neck region is the portion where new segments continuously grow. so long as the worm remains attached to the host. A segment called proglottid can be classified into three types: immature, mature, and ripe or gravid. Human infection with Taenia species occurs whenever undercooked beef infected with T. saginata cysticercae or pork infected with T. solium cysticercae is consumed. Cysticercosis occurs after humans accidentally ingest embryonated T. solium eggs or gravid proglottids from T. solium carriers. T. solium carriers may contaminate water supplies or contaminate food directly, causing cysticercosis and neurocysticercosis in consumers. Human infection with the dog tapeworm, Echinococcus granulosus, occurs through contact with infected dog feces. Infection develops in dogs when they ingest organs of other animals harboring tapeworm larvae, leading to infection with the adult tapeworm. Eggs are passed into the feces of the dog and, if ingested by humans, can result in the development of complex cysts in tissue and is termed echinococcosis. Human infection with Typhlobothrium latum occurs when undercooked freshwater fish infected with the plerocercoid larvae of T. latum is consumed. Humans are the main definitive host for D. latum and the most important reservoir of infection. When eggs are discharged into fresh water, they hatch and release motile embryos, which are ingested by tiny water fleas, the first intermediate host, following ingestion of the water fleas by larger crustaceans and fish, the second intermediate host. These motile embryos develop into larvae, which are infectious to humans. When raw or undercooked infected fish and crustaceans are eaten by humans, these larvae are ingested and develop into an adult tapeworm in the intestine. Hymenoplepsis nana, also known as dwarf tapeworm, is a cyclophilidian tapeworm with embryonated eggs. It is probably the most prevalent tapeworm worldwide, and it is the only tapeworm that can be transmitted directly from human to human. Human infection occurs via ingestion of parasite eggs on fecally contaminated food or fomites.
Treatment and prevention. These infections can be treated in different ways. Hymenoplepis nana, Diphylobothrium latum, Taenia saginata, and Taenia solium can be treated by taking up the drug praziquantel and niclosamide as an alternative. Echinococcus granulosus, on the other hand, can be treated with albendazole or chemotherapy with or without surgery. Cyst puncture and PAIR, which stands for percutaneous aspiration, injection of chemicals, and reaspiration, are also possible treatment options. Although parasites can be easily prevented through the following measures. Hymenoplepis nana can be prevented through good hygiene, conducting public health and sanitation programs, and rodent and insect control. Echinococcus granulosus is prevented by avoiding contact with wild animals such as foxes, coyotes, and dogs and their fecal matter, limiting interactions between dogs and rodent populations, and practicing again proper hygiene. Diphylobothrium latum, the fish parasite, can be prevented by avoiding the consumption of raw or undercooked fish, while Taenia saginata is prevented by avoiding eating raw or uncooked beef. And of course, the pork parasite, Taenia solium, is avoided by cooking pork well and thoroughly.
If symptoms persist, consult your doctor.
Laboratory diagnosis. Diagnosis of Taenia tapeworm infections is made by examination of stool samples from the patient, in which they should also be asked if they have passed or defecated tapeworm segments. The specimens should also be collected on 3 different days and then conduct a microscopic examination of the specimen for Taenia eggs. The eggs can be detected in the stool for 2 to 3 months after the initial time infection.
Before we end this very long conversation about cestodes, we just like to remind you to watch out for your
Feces, to watch out for your feces. Look for anything different, like maybe wiggling stuff.
Ew.
Yeah, yes. Also, don't eat uncooked meat like raw
fish,
beef,
raw pork. Just don't eat anything uncooked.
Yeah, just make sure like cook it thoroughly.
Don't burn it though.
Yeah, don't burn it. That's bad as well. So like just also watch out for contaminated water and just overall live a healthy life. Wait.